Surgery is a major event for children. That is why it is important that they and their parents feel at ease. The child-oriented principles of the Child and Hospital Association focus on this. Bronovo is the only hospital in the Haaglanden area fulfilling these principles, which makes it an extremely child-friendly hospital. For example, apart from during the operation, parents can stay with their child the whole time, from when the anesthetic is administered until the child awakens. The anesthesiologist, ENT specialist, operation theatre staff and pediatric nurses work closely together to ensure that all care for your child is properly coordinated. From a medical point of view, the removal of adenoid and tonsils and the insertion of grommets in the ears are simple procedures. However, for children and their parents or carers, it can be a major event. Good preparation is important and reduces the chance of any stress. That is why we want to explain the entire procedure. For your child, we have special children's versions of this film. In this film, Ernst and Bobby give your child an idea of what to expect. Do watch it together.
In the waiting room there are 3 to 6 children, no more, because everyone must be treated within an hour. The little ones are going to be operated first because they have a hungry feeling and they don't understand that hungry feeling. So we want to make sure they don't have to wait too long.
Until 5 hours before admission, your child may not eat anything and brush her teeth. If necessary, your child may drink clear fluid until 5 o'clock in the morning.
Yeah.
Fasting is very important because if eating or food or drink comes from the stomach into the lungs, it would be dangerous for your child. Therefore, in case that your child has eaten or drink after 5 o'clock in the morning, we would have to cancel the operation.
But you can't eat anything before your operation in the hospital. Oh, I'm sorry.
Oh, I'm sorry too.
When the tonsils are removed with your child, we advise to give your child a suppository paracetamol and diclofenac at 7 o'clock in the morning. Both suppositories you get at the first pre-assessment meeting with the anesthesiologist, together with a pain management for the first 3 days after the operation. During this pre-operative assessment, we also demonstrate the mask and the balloon, which your child is going to use during the operation. She has to blow into the mask and blow up the balloon, and then he or she will fall asleep within 1 minute.
Having surgery can be a worrying experience, so you have to watch on your facial expression and your body posture. That's really important. So you are relaxed and you will see it in your child. They are relaxed also. That's really important because it's a hard day for both.
The drink we give your child makes him or her sleepy and relaxed, so that any tension is reduced. There are about 5 people in the operating theatre: the ENT specialist, the anesthesiologist and assistants. Your child may keep his clothes and shoes on, and as a parent or companion, you may do the same.
One parent may come with the child to the operating theatre and help the child on the table. After that, we give the child the mask and the balloon, and the child has to blow into the mask or to blow up the balloon to fall asleep. That takes about 1 minute. You may stay with your child until the child is asleep. After that, we accompany you to the recovery room, and there you can wait until we bring your child back to you. Children whose tonsils are removed, they receive an intravenous drip during the anesthesia, just for safety reasons.
We use what is referred to as the Schluter method. We do not need to intubate your child, so no tube is inserted into his or her throat. This is a very fast procedure. You only will miss your child for a couple of minutes. We remove the complete tonsils without the use of a surgical knife. During the procedure, your child is monitored constantly by the anesthetist and the complete surgical team.
After the operation, your child will be taken to the recovery room. This room, where parents wait for their children, is next to the operating theatre. That is convenient. Problems are very rare, but if anything does happen, expert nurses and the doctor are immediately available.
Children react differently from anesthesia. Some children wake up very calm, while others are very restless. Most children cry a little after the operation when waking up further, because they hear sounds louder or they are disoriented. Your child will wake up within 2 or 3 minutes after the operation. We see that because your child opens his or her eyes, and then we immediately go to the parents in the waiting room. Then they can wake up further with their parents.
The doctor always comes by to tell how the operation went.
Hi Bobby, operation went really well.
Okay.
And since you're really awake now, you can go home.
Children whose adenoid has been taken out or who had grommets fitted in their ears can go home directly from the recovery room.
Children who have removed the adenoid, they have a little pain. But most scary is that there's a little blood of the nose coming, and that's scary. But it's not a problem. It stops. When the children have tubes, they have no pain, but they hear the sounds very loudly after the surgery. They may not swim for 1 week. When you have any questions, you can call the ENT outpatient clinic, and they have the answers for you.
Only the children whose tonsils have been removed go from the recovery room to the pediatric ward. In the children's version of the film, the pain Bobby feels after the operation is soon gone. Most children whose tonsils have been removed experience a little more pain.
I will get a call around 9 o'clock from the recovery room. Then I will take you and your child to the 5th floor where our pediatric ward is. When we arrive here, I will give your child a glass of water. If that's going okay, then I will give some ice cream. And the intravenous strip will stay put until you're going home, around 11 o'clock.
Bye-bye. Thank you.
When you get home, you have to check the temperature every once in a while. When your child is having a fever, and that's 38.5 degrees, then you have to call the ENT clinic to discuss what to do next.
Outside office hours, you can call the emergency ward. There is always an ENT specialist on duty.
You have to watch for bleeding. Your child can get a secondary bleeding. You can recognize it by vomiting bright red blood. When it's dark red, that's okay, because that's normal.
In general, children are fully recovered after 1 week. Depending on the type of surgery, the result is that they hear better, eat better, and sleep more peacefully.
And no problem for me to have another surgery over here. Really nice people, huh?